New York is lifting the statewide mask mandate for schools starting on Wednesday. Local governments will now be able to make their own guidelines based on cases in their area. New York City Mayor Eric Adams also announced changes to COVID guidelines. Starting on Monday, March 7th, vaccine passports will no longer be required. That means customers will no longer have to show proof of vaccinations to enter restaurants, gyms, and other indoor venues. So what does all of this mean? And are we finally getting out of the pandemic? Let's hope so. Joining us now to talk about this is emergency medicine physician, Dr. Tsion Firew. Good to see you, doctor. Appreciate you being here with us. Do the changes from the CDC mean that we're in the clear? Is the pandemic coming to an end?
I wish that was the case, but as somebody who's been working in the emergency department for the past 2 years, somebody who's doing a lot of global health work too, we're really not there yet. Yes, as though the vaccination uptakes in the U.S. and with the numbers, and now we're just, 1 month out of the peak that we were in, with hospitalization rate being the highest for this year in January. So I think, the recommendations from the CDC, where they're putting it on the community level, I think it's a progress towards like lifting most of the recommendations. But I would say, some of the things that, especially with looking at the hospitalization rate, we would say most healthcare workers is not a good indicator, because hospitalization, as we know, they do lag. It takes 2-3 weeks after patients become positive or test positive for people to end up being hospitalized from COVID. So some of the recommendations, it's not putting at ease for many healthcare workers. We just feel like it's a bit too soon. And really, as we've said, the pandemic is not over until it's over for everyone. Look what happened with Omicron, right? It started in Europe and South Africa, and pretty much, propagated to the Americas. So we've seen it, how still interconnected we are. And we've seen also the low vaccination rate in many parts of the world. So the pandemic is not over until it's over for everyone. It's not what, politicians or what I want it to be, but it's going to be the number and the data that is coming from the rest of the world. But this is a progress forward, looking at the positivity rate, the vaccine uptakes, those things. You can make some local and guided decision to lift some of the mandates.
Yeah, it really comes down to the individual and the areas where you live, of course, because the mask mandates and requirements are changing. So people really can't be sure that it's okay to go without their masks. I actually saw a very funny meme. It said, "I'm still wearing my mask because y'all are nasty and I have trust issues." So I guess it really depends on where you are. But what about getting the whole country vaccinated? That was a big push in the beginning. You don't hear as much about that. Tell me about the push to get the entire population vaccinated, or is that just something that is secondary now?
So you touched on two issues. One, as we've seen, kids under 5, they're still not eligible to get vaccination. They're at higher risk. People also who are immunocompromised. There's still people who are not able to get the vaccinations because of their health status or because of their immunocompromised situation. But the uptake, especially in the U.S., compared to many high-income countries, is lower. So we're really hoping that people who are still skeptical and have low confidence in the vaccination, the data speaks for itself. It has reduced the burden on hospitalization. I think hopefully at this point, people will be convinced to get the vaccination. But as we know, this vaccination has been so politicized. There are a lot of people benefiting from this. There are people using it for political reasons. So unfortunately, there are people, their minds that we won't be able to change. But with Omicron and with the decreased hospitalizations that we've seen since the vaccine has become available, it speaks for speaks for everyone. And hopefully people will be at this point, they're persuaded to take the vaccine. But we're still looking forward to get vaccines available for kids under 5. So schools mandate and the vaccination mandates all over the country, hopefully that could also help. And one of the things that you touched upon, New York City is now not going to require proof of vaccinations for indoor dining or indoor activities. At this point, this is one of the decisions that I would disagree with the mayor and also with the governor, because it's too early. And we know that vaccinations mandate do actually work. When I have friends and people that were not into the vaccinations, but when their job required them to do so, or because they wanted to do indoor activities, that convinced them to get the vaccine. So vaccine mandates do work, and hopefully that is something that we'll be able to have going forward. But unfortunately, I think most of the decisions are political, and they are unfortunately ending the requirements.
Interesting you say most of the decisions are political. Does that mean you think that parts of the country could be better off than others?
Yeah, and we've seen it, right, with the Delta variant, especially when people were anti-maskers in the South, especially over the summer month, because people are staying indoors to get some more air conditioning. We've seen it over the summer how places like Florida and Texas, with the Delta variant, how they were affected, the burden on the hospitals, on healthcare workers, that all was insurmountable. So I still worry how this Omicron variant still may, or a new variant might come in, especially in places that have low vaccination rates, and to continue to have the burden on healthcare workers and on the hospitals. I'm praying for better days. I would say, many healthcare workers, we're so over the pandemic. We really look forward for better days. But unfortunately, we have to move forward cautiously and be very vigilant to what's happening in the rest of the world.
All right, doctor, thank you so much for joining us with that very important information.